Hey dear students, welcome to the chapter Reproductive Health. Let's learn about that. Make sure that while learning, you must have to make notes so that it will be easier for making revision. Now, we will deal with reproductive health. Let's learn what we will deal with in the chapter. First, we will deal with birth control methods. We will deal needles, white need, methods, contraception, we all need. Then, we are dealing with medical termination of pregnancy, MTP, sexual transmitted disease, amniocentesis, infertility, assisted reproductive technologies, and IVF zip to gift. All about that we will deal in this chapter. So we will start first. See, all of the WHO organization, as known as World Health Organization, as reproductive health is a total well-being and aspect of reproduction. That is physical, emotional, behavior, and social. Not all in health it means physical healthness. It will be also emotional, behavior, and social. It is the definition of WHO. Clear? So what have reproductive health? It has some problems, strategies that given under 1951. Now see, India initiated reproductive health program, that is family planning, in 1951. Wider reproduction related such as an operation under the reproductive and child health care, that is RCH programs. Clear? Such programs deal the following, such as it give awareness about reproduction, like creating a reproductive healthy society for different individual to teach different society backgrounds areas like that. Educated people about birth control, care of pregnant mother, postnatal care of mother and child, importance of breastfeeding, equal opportunities for male and female child, etc. Clear? Or awareness of problem due to population explosion, social levels like sex abuse and sex related crimes, etc. So created awareness programs dealing the following related reproductive health. Clear? So this is all about that. Now what are the aims and needs of sex education? Why it is necessary? Why it is necessary in a school, college and other areas? But because to write information about sex related aspects, it helps to avoid sex related myths and misconceptions. Clear? You already know what will happen in the societies and the background areas, so that it is needed to given sex education in schools and college backgrounds. Clear? To give proper information about reproductive organs, adolescence and related changes, safe and hygienic sexual practices, sexually transmitted diseases, AIDS, etc. Clear? For the prevention of STDs, AIDS, it is important to give education for sex education in schools and college areas. Clear? So it is important. Now, population explosion and birth control. What is that? In 1900, it is very important. Data comes in the exam. Now, in 1900, what will happen? The world population was around 2 billion. That is 2000 million. By 2000, it rocketed to 6 billion. See what will happen? 1900, population become 2000 or 2 billion. After that, it seems extremely 6 billion. Clear? But in India, population was nearly 350 million at the time of independence, 1947. It crossed 1 billion in May 2000. It means every sixth person in the world is an Indian. Clear? It is very important line comes in the Neet exam. According to the 2001 census report, our population growth rate was still around 1.7%. That is 17 by 1000 per year. That is a rate at which our population could be double in 33 years. Clear? It is an important data. It is in 900, it comes into 2000 billion, and after 2000, it goes rocketed as a 6 billion. Clear? So this is an important data come under exam. Now, reason for population explosion. What are the reason for population explosion? Due to increased health facilities and better living condition, rapid decline in death rate, maternal mortality rate, and infant mortality rate. It increases the number of people in reproducible age. So these are known as the reason why population explosion occur. Here, what are the impacts of population explosion? Why? Due to basic requirement, food, shelter, and clothing. These are the impacts. But what have control measures? See, Statutory rising of marriageable age female 18 years and males 21 years. But now it is going to change. Now female have 21 years or men have 24 years, like that. But awareness comes under when the slogan has been started as hum do hamare do. It is we two, our two. Many couples have adopted a one child norm. Clear? So those have do not have child, do not have their child, they can adopt a individual. Clear? So motivate smaller families by using contraceptive. These are the control measures. Now, what are the properties of ideal contraceptives? It will be user friendly, easily available, effective, reversible. Clear? So these are the properties of ideal contraceptive. But it has also less side effects, as well as it should not interfere with sexual drive, desire, and sexual act. That's why it is an ideal properties of contraceptive. Clear? Now, contraceptive methods, we will deal natural method, burial method, injectable methods that we all are deal with that. First, we will start natural methods. Learn properly and make notes each and every point. I had extract all the points from the NCRT as well as refresher. So make sure you have to note down all the important points. Now see, what are natural or traditional method? Avoid chances of ovum and sperms meeting. Here, these are known as traditional method or natural method. In the last era of societies, there were no contraceptives. So that what they use natural methods or traditional methods to prevent pregnancy. See, first is periodic abstinence. Avoid coitus or avoid intercourse from day 10 to 17 of the menstrual cycle, fertile period. Clear? To the menstrual cycle, it is a fertile period to prevent contraception. So first is periodic abstinence. That avoid intercourse from day 10 to 17. Why? Because in the it is a fertile period. Clear? Second one is coitus interruptus or withdrawal method. Very common method. What will happen? Men withdraw penis from the vagina just before ejaculation. Why? To avoid insemination. Clear? So it has very important logic that men can withdraw penis from the vagina before ejaculation. Like sperm is released before the ejaculation or before the insemination, so that pregnancy can also be prevented. That is known as withdrawal method or coitus interruptus method. Now, lactation amenorrhea. It is the prevention of conception by breastfeeding. When the child is breastfed, then ovulation occur, so child cycle do not occur. So that's why this is the period of lactation. In the period of lactation, there will be no menstrual cycle. So that easily it can be occur, or easily it is the prevention of conception. Why? Due to lactation period is there. Mother feeding is rarely. But this is effective up to 6 months only because feeding occur, but it up to last for 6 months or 7 months following the parturition. It has no side effect, but also chances of failure are high. So that's why one is best coitus withdrawal method or periodic abstinence. Clear? Now we will deal barrier method. These are artificial methods like condoms, known as Nirod. It is made up of rubber and latex or rubber or latex sheath. See, condoms for male, it covers the penis, and female, it covers the vagina and cervix. They prevent physical mating of sperm and ovum. Condoms are just used before coitus or intercourse or sex. Yeah. So they prevent the entry of semen into female reproductive tract. This is the male and this is the female. Clear? Why this is very popular? Because it protects STDs, AIDS. It is easily available and disposable. It can be self-inserted and thereby give privacy to the user or customer or an individual. Yeah, so these are very popular. Now, what is intrauterine device? See, these are inserted by doctors or nurses in the uterus through vagina. They increase phagocytosis of sperms. IUDs are ideal contraceptives for the females who want to delay pregnancies or space children. You ever seen sometime your mother has taken fast, but sometime menstrual she want that menstrual can be delayed. So what she will do? She will take any pill. Why? To delay menstrual cycle. So these are the like that. See what will happen? There are the types of IUDs. Non-medical IUDs or non-medical IUDs, they retard sperm motility. What they will do? They retard sperm motility. Retard means it suppresses the sperm motility. Also have spermicidal effect. For example, lip will slope. Very important example. You have to learn all the examples. Very important. Copper T, that is copper releasing IODs. Copper ions suppress motility and fertilizing capacity of sperm. What they will do? Copper ion suppresses motility and fertilizing capacity of sperm. So that, for example, what will happen? For example, copper T, copper 7, multiload, etc. These are copper T. Very important. Copper releasing iodines as copper T, copper 7, and multi-load 375. Very important. Will come under exam as well as in your NEET or any professional board exam. Now, hormone releasing iodines. They make the uterus unsuitable for implantation and the cervix hostile to the sperm. For example, progesterone and LNG20. Both three types and examples are very important for your exam. Clear? See, this is the female vagina. Clear? This is hormonal iodine. This is copper iodine. It will be inserted. This look like single strip. One strip is like that. It will be hold down and it will be something like that and will be attached to the vagina. Clear? Something like that. Copper teeth occur. Clear? It will prevent your pregnancy. Clear? Next, oral contraceptive. Oral administration of progesterone or estrogen combination in the form of tablets. What? Oral contraceptive, but what is the combination? Combination of progesterone and estrogen. It- See, pills are taken daily for 21 days, starting within the first 5 days of menstrual cycle. After a gap of 7 days, that is menstrual period, it should be repeated in the same pattern till the female desires to prevent conception. Clear? It will be daily taken for 21 days. Very important. If single a day will miss any chances, any kind of rather example, so it have to start it again previously. Clear? We cannot miss this period, this pill. We have to take on continuous as a 21 days within the first 5 days of menstrual cycle. After a gap of 7 days of menstrual cycle, it should be repeated in the same pattern as usually we had taken the first time. Clear? So when till the female desires to prevent conception. Pills are very effective with laser side effect. Side effects are also very less. They inhibit ovulation and implantation and thicken cervical mucus to prevent entry of sperm. Clear? What will they? They inhibit ovulation and implantation and thicken mucus to prevent entry of sperm. For example, your Saheli. This is new oral contraceptive for the females once a week. Once a week pill is there. It can be taken once a week only. Clear? It is developed by the Center Drug Research Institute CDRI in Lucknow. It contains a non-steroidal preparation. It is a once a week pill with very few side effects. That's why Sahili it can be taken once a week on a single week pill is taken and high contraceptive value. Clear? So it is oral contraceptives. Now, injectables such as progesterone and progesterone estrogen combination are used by females as injections or implants under skin. Their mode of action is like that of pills and very effective periods as much or longer. Progesterone estrogen combination and IUDs are used for emergency contraceptive within 72 hours of fetus. It avoids pregnancy due to rape or casual intercourse. Clear? If someone has done rape, then what will doctors will do? In the 72 hours, if 72 hours, below than 72 hours, then mifepristone and mifepristol or progesterone or estrogen combination pills can be given to prevent pregnancy. But if above 72 hours will be done, if above 72 hours, then the pill will not be effective. Clear? For example, I pill, many pills are there nowadays, but the main point is that it has a combination of progesterone and estrogen. Then also this pill will be effective, otherwise not. And what is the condition? It should be under the 72 hours only. But if it is above 72 hours, then it will not be effective. Clear? So this is the important term. This is very important. What is injectables and what it is done. Time period and formulas like progesterone and estrogen combination as a hormone. Now, surgical method. If someone has to prevent pregnancy completely, then what will do? It helps to block gamete transport and thereby prevents conception. Directly, what will do? In the vasectomy, vas difference cut and tied, something like that. Clear? Cut it from the both side. Insertion has been done and it will be tied. This is known as vasectomy. Fallopian tubes also. Fallopian tubes tied and cut it down. Incision takes place. This is known as tubectomy. Once it will be done, once incision has done, you cannot reverse it. Remember, once a time reversible not occur. Clear? Once incision, it cannot be recovered. Clear? Clear? So surgical method is it is very effective, but reversibility is very poor. Something we can say not possible. Check. So surgical method is what? It helps to block gamete transport and thereby prevents conception. Or you should know fallopian tubes cuts and tied down. Also was what was difference cuts and tied down. Very important. Now vasectomy is what? Sterile position is male. Sterilization procedure in males. In this small part of was difference is removed and tied up to a small incision on the scrotum. This is vasectomy. But what is tubectomy? It is the procedure in females. In this, a small part of fallopian tube is removed or tied up through a small incision in the abdomen or through the vagina. Clear? Side effect: antinatural contraceptives such as nausea, abdomen pain, breaking through bleeding, irregular menstrual bleeding, or breast cancer can be occur, but the rare cases. Clear? So this is all about that. Now, what is MTB? Medical termination of pregnancy. What actually done? Medical termination of pregnancy is what? It is an intentional or voluntary termination of pregnancy before full term is called MTP or induced abortion. About 45 to 50 million MTPs are performed in a year all over the world. That is one-fifth of the total number of conceived pregnancies. So, MTP decrease helps to decrease the population. Clear? Many countries have not legalized MTP due to emotional, ethical, religious, and social issues. But India has not. But Government of India legalized MTP in 1971, very important, with some strict conditions to check illegal female feticides. Previously, feticide has been done. Why? To check whether the child is male or female. If female, then it will be right. Clear? So MTP has to done. Now, what are the importance of MTP? To avoid unwanted pregnancies due to casual intercourse or failure of contraceptive used during coitus or rapes. Clear? It is essential in cases where continuation of pregnancy could be harmful to the mother or to the fetus or both. So it is important to use MTP, but it is very important that when MTP is safe, it can be safe up to first trimester only. That is up to 12 weeks of pregnancy only it will be safe. Second trimester abortion are very risky. Clear? Must remember MTP are safe during first trimester only, that is 12th week only. Clear? But second trimester abortion is very risky. Clear? So what are the problems related to MTP? See, majority of the MTPs are performed illegally. Misuse of amniocentesis. What do you mean by amniocentesis? Amniocentesis kind of, this is the fetus growing the mother womb. So the cells can be taken by the injection and it will determine sex of the fetus, whether the child is male or female. And if child is female, she can be died. Clear? And abortion will be done. That is the previous method, previous laws of the society. So these are the misuse of amniocentesis of fetal sex determination test based on the chromosomal pattern of fetal cells in the amniotic fluid. Clear? If the fetus is female, it will be followed by MTP as the previous laws. Such practices are dangerous for the young mothers and fetus. Clear? These are the problems related comes to the MTP programs. Now, what is sexually transmitted disease? Do you ever know? Have you ever seen what is STDs? Have you ever thought STDs, AIDS, HIV? What is it? What will it happen? Why did it happen? So, disease transmitted through sexual intercourse are known as sexually transmitted disease. If one individual is already infected, for example, if this is male and this is female, female is pure, but he is not pure, impure. He has done intercourse with multiple partners, but female has not done. So what will happen? Male can be infect female by STDs or AIDS or HIV or anyone, any gonorrheal disease or any vaginal infection. When if man had done two plus or two to more than females can be in the relationship, then it can be affected. If female had done, it also be affected. Clear? If female had done more than two peoples, then it can be affected. If male had done three then plus, it can be affected. So this can be happens by multiple sex partner only. Clear? If individual had taken and if individual had done multiple sex with multiple partners, then STDs or vulnerable diseases can be happen. Clear? So make sure it will be not happen. See, vulnerable disease or reproductive tract infection, that is RTI. For example, gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and HIV leads to AIDS. Clear? Now, hepatitis B and HIV are also be transmitted. How? By sharing of injection, needles, surgical instrument. Why needles? For example, if I had inject, this is universal patient and this is non-universal patient. What do you mean by universal and non-universal? Universal patient, it means it have HIV or AIDS or whatever it has. But non-universal has do not have HIV, that is non-HIV or non-AIDS. Clear? See, what will happen if I had inject any injection, any kind of injection. If same injection, I had injected this universal patient and same injected with needle, I had injected to this non-universal patient, then it can be harmful. Why? Because bloodstream can goes to another person or this needle prick can be in my hand also. Then it can also be spread through blood to blood stream generally by the blood itself. So make sure for the universal patient or HIV rate. So by sharing injection needles or any surgical instrument, that is by transfusion of blood to blood contact, directly it will affect. Otherwise, if you can touch HIV patient, nothing will happen. But if blood transfusion will occur by the needles or by any surgical instrument, it can be affected by HIV, or you can be affected by HIV, or from infected mother to the fetus. But you had generally seen in the hospitals or cases by that 18 years or 17 years of individual had HIV or STDs. So they had done multiple intercourse. Is it like that? No. It means not that they had done multiple intercourse in the age of 17, 16, or 18. It is why? It is why because of from the infected mother to the fetus. Clear? They have to take on constant medicine, constant in the follow-up checkup, but it will be affected from the mother to the fetus. Not why because they have a multiple sex partner. No, it will be also can be happen if infected mother to the fetus can be done. Clear? So that by the age of 16, 17, 18, or 19, HIV or STDs can be occur. Already occur, but sometimes it will be. We have some doubts that they had done a multiple sex partners. No, it's not like that. Clear? So this is not like that. Now, except hepatitis B, only hepatitis B, genital herpes, and HIV. Other diseases are completely curable. Except hepatitis B, genital herpes, and HIV. Genital herpes is what? Infection in the genital area. HIV, other disease can be curable if early detected properly. Clear? Early symptoms kindly itching, fluid discharge, slight pains, swellings in the genital region. Absence or less significant early symptoms and social stigma defer the infected person to consult a doctor. This will lead to pelvic inflammatory disease, that is PID, or infertility or ectopic pregnancy. What do you mean by ectopic pregnancy? What do you mean by ectopic pregnancy? For example, this is your vagina and implantation here there. It has to done. Clear? This is implantation. This is normal implantation. But in the ectopic pregnancy, implantation can be done here and there. Some clear? So this is known as ectopic pregnancy. Ectopic means very unevenly, undifferently. Clear? So not in a correct position. If if pregnancy is not in correct position or not in correct situation, then it is known as ectopic pregnancy. Or abortion, a stillbirth, cancer of the reproductive tracts can be lead. All persons are vulnerable to STDs. All are high among person in the age group of 15 to 24 years. Clear? What are the prevention? Avoid sex with unknown partners or multiple partners. Very important. Always use protection during intercourse. In case of doubt, go to qualified doctor for early detection and get complete treatment. Clear? Now, infertility. It is the inability to conceive or produce children even after 2 years of unprotected sexual intercourse. The reasons, it may be physical, congenital disease, drugs, immunological, or even physiological. You had ever learned or ever seen that after the marriage of 2 years or 3 years or 5 years, the child is not done. Why? Pregnancy cannot occur. Why? Multiple reasons are there. Due to low sperm count of male or due to some problems in the females, it can be done due to lack of pregnancy here, so that pregnancy will not occur. Why? So we have some technology so that infertility can be decreased and fertility can be happen. So there are some technologies used to correct infertility problems. First, in vitro fertilization, that is test tube baby program. You have ever known? You have ever seen what is test tube baby program? In this method, ova from the wife or donor and sperms from the husband or donor are collected and are induced to form zygote under stimulated conditions in the laboratory. This is followed by embryo transfer, that is test tube baby program. And what will happen in the embryo transfer? It is of two types. One is zygote intrafallopian tube or intrauterine transfer. In the ZIFT, what will happen? Transfer of zygote or early embryo up to 8 blastomere, not 7 blastomere, up to 8 blastomere into fallopian tube. What I have said, transfer of zygote or early embryo to 8 blastomeres only into fallopian tube. In the intrauterine transfer, transfer of embryo with more than 8 blastomere into the uterus. Clear? So this is zygote intrafallopian tube and this is intrauterine transfer. These are in vitro fertilization. What will happen? In the laboratory, all the formation will be done and it will be transferred to the fallopian tube. Clear? This is the only way. So embryo formed in the in vivo fertilization. Fertilization within the female is also used for such transfer to assist those female who cannot conceive. Clear? Now, next one is gamete intrafallopian transfer, that is gift or in vivo fertilization, not in vitro. Transfer of an ovum from a donor into the fallopian tube of another female who cannot produce ovum but can provide suitable environment for fertilization and development. If a woman cannot conceive or produce ovum, but by the providing the suitable environment, it can be conceived or it can be fertilized and developed. Clear? So this is gamete intrafallopian transfer. Now intracytoplasmic sperm injection, that is ICSI, it is an in vivo fertilization. It is a laboratory procedure in which a single sperm or from male partner is injected directly into an egg from female partner. After fertilization, the embryo is implanted into the woman's uterus. Clear? What is artificial insemination? That is AI technique. The semen collected from the human husband or donor, it is artificially introduced into the vagina or the uterus of the female. Artificial insemination into the uterus is known as intrauterine insemination. This technique is unique for the male partner having inability to inseminate or low sperm count. The individual has low sperm count or unable to inseminate the female, so that artificial insemination, this technique can be useful. Now, surrogacy. Surrogacy is what? Surrogacy is here a woman surrogate mother bears a child for a couple. Another woman bears a child for a different couple, so that why? Because the wife is infertile, unable to carry. So another woman can carry out, or another woman can surrogate the baby. So the surrogate is impregnated through artificial insemination or implantation of an embryo produced by IVF. Yeah, these are very important. AI, gift, surrogacy, very important. Now, what are the problems of art? What happened? It requires specialized professions, expensive instrument, very costly. It will be present only a few centers only, but now facilities are available almost everywhere. Legal adoption is also a good method for couples who are looking for parenthood or who cannot conceive. It can also be a best method for legal adoption. So we had learned reproductive health, a very important chapter. It will very easy and very important. It will become under exam. You must have to learn. Wishing you all the best. Good luck.